start, sir. Let's start, sir. Hello. Let's start, sir. Sir. Let's start, sir.
Yeah, welcome to the today is the 75th session of the series which we call as National Reincarnation, and this is part of Unleashing India to see to it that we as a nation, we as a world citizen, come and go back into a good whatever we call as growth. We are calling it reincarnation, and this is because of, as we all know, because of this small thing called COVID. And today we have two experts. Before we start, also let me congratulate them because these are the type people who have brought India to its foremost position of its premier expansion or premier positioning or whatever we say, whatever has been done by India through them is something exceptionary. You know, if you see even today's facts and figures, today in India, we were closest to Wuhan. In spite of that, 0.8% of Indians were affected, and out of 0.8%, 98.5% have got cured. Okay, so which means the death, whichever is reported, is something which could have been less than the normal, all because of the medical professionals and the way they have put their heart out to see to it that things go to a good level. And very fortunate to have two medical experts. Now today, what I will do, as usual, is that I will first make a small presentation and then call our experts to give the comments, give their talk. I will just rush through this. I'm not going to give really the presentation as presentation. This is just to give a flag of today's. Yeah. Now, what we are calling is, enhanced role of medical innovation for national reincarnation. Nobody better than the people who are in front today. So I will go through them pretty quickly. Now, as we all know, this is one of the standard slide I always present to know what is India, because we are almost 206 countries put together. We are with multiple diverse language, religion, say, culture, whatever we say, we are the biggest and most prominent. At the same time, we are the oldest civilization. We are a 10,000-year-old civilization. We should never be proud of saying we are a 70-year-old country. And we have got all that is needed for leading the world back and at the time leading from the top. As I said, COVID is something which has really destroyed us. COVID is a World War III, but by an alien called COVID, and it is something which is invisible, which is something which is very small, but it has attacked the whole world as nothing will have. And as I said, thanks to the experts like the two who are in front of me and who have made at least India proud of the achievements. Now, these slides are generally to indicate, what is it that we have done as India in medical sector? What are the facts and figures? Because there are certain confusing facts and figures. We generally project to the world that we are something low in medical and we are doing this. Yes, we have to do because we have got a population which is growing. Other than that, we are good. And just to a small joke which is there with many of my medical professionals themselves say, they treat all the patients, but they are themselves treated by their own mother and grandmothers. They say they're as effective or more effective. Now, why I'm giving the example is, India has got a history of having a good medical system. That is why we should not go by the fact of the ratios or numbers, because we have now proved that whatever number we have is much better than what others have in terms of, but at the same time, on no account, we are trying to claim that we have got enough doctors, because our population is high, we always need much more than what we have. But we need not feel shy that those ratios are not being met, because our own internal system is very robust, our own internal system is very strong, and that is good enough even for medical professionals. So, healthcare sector is one of the basic sectors which are required for human beings. As we all know that when Britishers left India, the average age of an Indian was only 27 years. In this 72 years, we have added almost 1 billion people from 350 million people. That is 1.35 million is today's population. And the average age I have not average age. The life expectancy from 27 has gone to almost 70. Again, thanks to the professionals in front of me. Because of them, things have really gone up and things are really good. And I'm sure, we would like to hear much more. So I would now probably go quickly close my detailed presentation, which is always available for any viewers. Now, in all this growth driving, growth this thing, I would like to spend 2 minutes on the secured governance. You know, secured governance is for self-sustained growth of economy. Now, self-sustained growth means whenever, especially in medical, health, medical, education, and all, money is required from by the government or by whosoever is putting. In secured governance, we generally prove how from the system itself money can come and that can sustain or make things grow. It is a more detailed affair. It is just for people to know that these industries can also go by harnessing what we call as hidden potential. The hidden potential is the way we grow. Hidden potential is the way the rules are framed. Hidden potential is also by the way things get integrated with the other system. So when there are a couple which will make the system go well. And since we have two experts, let me have the privilege of introducing both experts, Dr. Mohan Rajan. He is one of the pioneers of a great different degree in terms of the work he has done, in terms of the name he has achieved, in terms of the good name he has brought to India from various countries. He has also done a lot of work in UK, USA, and all, but primarily done the best part of the work in India in the form of Rajan. But he is one of those who is always ready to help. For him, money is almost small aspect. People generally confuse. He is an opposite specific person. He does not have money as the main thing. Yes, money is required for his growth, which he doesn't. He doesn't take money for his personal growth. And he has developed a series of this thing. And a second professional is Dr.Sanjay Pattiwar. Fortunately, we are having him second time. Last time also, we had the privilege of hearing him out along with the Indian Medical Association president. And today also I requested him to come to have a professional thing, because at the time, it was in June beginning. Things were really bad. Things were really, the way. Today we are a proud, we can start the thing with our victory sign. The way the numbers are come, and as I again repeat, that most of the credit goes to Professor like you. And he has been the ex-additional commissioner, one of the most favorite and most liked additional commissioner of Navi Mumbai. And he is also something like an advisor to Traffic Trust. He is also advisor to the Government of India for monitoring many of the health-based activities. So I would like to start the first portion with Dr. Mohan Rajan. You could tell a little about yourself, because I know that you may not like to talk too much, but a little flavor of what is it that is your achievement till now and the way you have come to whatever you are coming. And then we will have Dr. Pattiwar. Then we will have you again in terms of COVID and post-COVID, what all things have to be done. We should not sit on our laurels that we have achieved the sky. Because again, second thing may attack and we may not have these type of numbers. So for it to continue to have, what is it that we should do, how we should do, and what are your own plans in contributing? Dr. Mohan.
Thank you very much, sir. Shall I share my screen, sir?
Yeah.
I'll share my screen now. And then... able to see my screen, sir?
Yeah, we can see it.
Good evening, ladies and gentlemen. Let me at the outset thank Dr. Shekhar and also Mr. Akram, the Policy Times, for the wonderful opportunity. It's always a pleasure being with Dr. Sanjay Pattiwar. I heard him last time about the budget, and he was a very impressive speech he gave. And it's always a pleasure to be here. I'm the chairman and medical director of Rajan Hospital, which is a super specialty eye hospital and a postgraduate institute of ophthalmology in Chennai. We have 4 branches in Chennai, 1 branch in Andhra as well. And we started as a small practice. My father was also an ophthalmologist. And we started in 1995. This year is actually the silver jubilee year for us. And along with my wife Sujata, who is also an ophthalmologist. My grandfather was also an ophthalmologist,
Okay.
general practitioner. So the ophthalmology runs in my blood, runs in my genes, and my two daughters are also ophthalmologists. So, yeah, so we have got only two eyes, but we have got six ophthalmologists in our family, and we started as a very small venture. But more importantly, when we started Rajan in 1995, we also started the Chennai Vision Charitable Trust, which is actually giving me a lot of relief, a lot of comfort in the sense that because of the Chennai Vision Charitable Trust, we are able to, which is the community ophthalmology wing of Rajan Hospital, we are able to spread our wings and also deliver quality eye care to one and all, making quality eye care available, accessible, and affordable, irrespective of caste, creed, and religion, and socio-economic status in this part of the country. And subsequently, we have grown from strength to strength in the past 25 years. And today we stand as one of the premier eye hospitals in this part of the world. And we are also a NABH accredited hospital. And we are also a postgraduate institute of ophthalmology with affiliation to the National Board of Examinations. So we also have a very busy eye bank which is supported by the Rotary, through which it's called the Rotary Rajan Eye Bank, through which we take care of the corneal blindness. As you know, corneal blindness is one of the major problems in our country, especially affecting the children, and we take care of the corneal transplant surgeries as well. So we started the Blind Free India project way back in 2005, wherein we took comprehensive eye care. We also have a Netra Bhavana project, which is a unique mobile project, which is a teleophthalmology unit, which is started in 2011, and which takes tertiary eye care to the rural doorstep. With these few words, I will go on to my presentation. Once again, I thank Dr. Shekhar for the wonderful opportunity. The topic is post-COVID devastation, enhanced role of healthcare and medical innovations for the national reincarnation of the growth. As you all know, change is the only constant. And COVID asked us, or what do you call the COVID taught us so many changes. You see the government, the chief ministers in Tamil Nadu. Yesterday it was Amma, and today it is EPS, and tomorrow we do not know who is going to be the chief minister. It can be Shashikala, Rajnikant, or even Mohan matter. So change is the only constant. So that is the way we have to keep on going. And these are all slides which I took from Dr. Shekhar's presentation as well. India at a glance is a huge country, huge population, but we are done well. And this COVID taught us so many lessons. It taught us how precious our country is. The sense that our country has become the gold standard for all other countries as far as COVID is concerned. And before that, we didn't realize that India was such a beautiful country. In the sense that because with all the infrastructure which is available in India, healthcare, especially the healthcare, we never realized that healthcare will be such a robust system which was able to take care of the COVID. Whereas other countries like US, UK, Brazil, and Europe, everywhere, the COVID was really a devastation. Here, everybody expected actually a time bomb to burst in India, but it didn't happen, mainly because the basic roots of the healthcare was very, very strong in India, which I always felt right from the beginning. And it is because, and the population, the people also cooperated very nicely. As you know, 1.3 billion population, 73% rural, 27% urban, per capita income is very, very less. Healthcare is only 4% of the GDP. The amount spent for blind people, as you know, rehabilitation, because I'm an ophthalmologist, I was closely associated with the blind people, active cases, closed cases. But more importantly, as Dr. Shekhar rightly said, I think it's very important that the recovery rate is as good as 9%, and the fatality or the mortality is less than 0.5 to 1%, which is better than the international statistics, which is simply amazing, incredible stuff, which is, I think, hats off to the government, to the people, to the health workers, to the paramedical workers, and to doctors, which has, because of the concerted effort of every single individual, this has happened. As you know, the healthcare functions through 5 segments: hospitals, pharmaceutical, diagnostics, medical equipment, medical insurance, and telemedicine as well. Now, telemedicine has become very important. Why India? The lower cost of treatment, alternative treatment like alternative medicines are available. Ayurveda, naturopathy, which is not available in other countries. world-class service and care, attraction of incredible India, less wait time, especially for transplant surgeries and other surgeries as well, ease of getting medical visa, which makes India more accessible and available to all the patients around the world. I've got some simple strategies post-COVID. What are the things we have to look at as far as healthcare is concerned? One is the EMR. EMR may be a government-funded EMR system with blockchain security. Okay, this will make the entire, what do you call, one of the main problems in the health sector which India has been facing is the standardization. The standardization of, for example, if you go to UK, right from London to the peripheral, that is to the Scotland, everywhere, there's a uniform standard of healthcare which is given because the NHS is a standardized system. Like that, we need to have also a standardization. For that, we need to have a basic EMR. The EMR is very, very important because the standardization is very important, the blockchain. The healthcare records, streamlining of healthcare records at the national level. This is also very, this what we call as national registry. The national registry has to be done for each and every disease, every individual for that matter. Just take an Aadhaar card, a national registry has to be done, healthcare record, which is again very, very important. Again, medical innovations, low cost, affordable medical innovations. Low cost, that is only possible in a country like India. Low cost, especially in China, there are low cost medical innovations. China and India only can make this possible because medical innovations can be done very, very cheaply, and this can make life easier for all the patients or all the people of our country. Again, involvement of engineering students and medical innovations with target hackathons is very, very important. For example, this is a small field analyzer, which is like a virtual handset, which can be just fixed. Otherwise, you need to put a patient on the computer patient. This can be done in the home. This home field analyzer, which is called the automatic field analyzer, wherein we just have to fix it on the eye. One of the medical innovations in ophthalmology, which has found big inroads, when they, especially the post-COVID scenario. Again, I find that this golden triangle is very, very important. What is this golden triangle? The combination of medical professionals, the engineering, because the engineering people have got the mind as well as the brain to find out something which is very, very new. Now it's become technology dependent. The medical profession is not only the human touch, but it's also technology which is necessary. You need to combine the technology with the human touch. And of course, the industry has to come in. The industry has to come. This is called the golden triangle. The golden triangle is very, very important because all the three have to work together in a unison to produce the best results and best results for the patients as well. Doctors' role in deciding the healthcare insurance coverage and reimbursement to be given utmost importance. Again, health insurance, like what is happening in the US, and this happened in the US about 50 years back, the health insurance is covered completely for every patient. So like that, the doctor's role is also very, very important. Public health education. This is where I think we are lacking a little bit. The public at national levels is very, very important. Again, at the national level, the public health education is one way where we can go in for health promotion, surveillance, monitoring, analysis, and disease prevention, and communication, and emergency recovery, and environmental health, and so many other factors coming into play. Again, I have to lay the emphasis on insurance. Government managed national healthcare insurance for essential healthcare, reasonable reimbursement. The coverage has to be compulsory enrollment for all the citizens and legal residents. Administration single payer system run by the government, and this is what I think I've been suggesting to the government of Tamil Nadu as well as the government of India as well as part of the healthcare team in Tamil Nadu. Innovations and commercialization, streamlined pathways for medical innovations to reach a commercialization is very, very important because the innovations has to, you need to have a path, you need to have a what you call system wherein the innovations have to become marketable and products which are usable or usable, what we call as clinical use. Okay, otherwise many innovations may go down the drain. So you need to make innovations and make sure there is a system which channelizes these innovations into a thing which brings out the what you call the end product, which is very, very important for the clinical use as well. Is biotechnology, the research institute called the BIRAC and other national government agencies to solicit innovations for specific unmet needs, funding directed to produce intellectual property, commercial partnerships with industry leaders as well. Workplace safety, including early detection of illness and treatment, is very important. Occupational health and safety, rights and responsibilities, the registrations, the safe workplace, risk management, all these are very important as part of the occupational health and safety, which you need to give emphasis now, especially in the post-COVID scenario. Collaboration between medical, engineering, design, and marketing community to produce world-class medical products in India. Already, many companies are making it in India and making it exporting to other countries like Africa, Europe, and other things, especially in the field of ophthalmology and even the other one, the medical innovations. Now, the medical innovations have become a very important. The medical industry has become a very important thing, which making which has to be very high quality with low cost as well. Telemedicine has become a very major role, and this is going to become a very major role in the future as well. Telemedicine rules and limitations to be defined to limit the liability of the doctors, to maintain patient safety. As you know, telemedicine is to be established as a standard, as this has become a very important. The modern technology minimizes individual investment. Instead, expert opinion and guidelines given minimizes travel of the patients, which is very important in the post-COVID scenario. Excellent periodic follow-up. We also have learned that we don't have to see every patient for every disease. And the COVID has taught us this lesson, is that over the phone, over the teleophthalmology, over the WhatsApp call or the video call and the telemedicine, we can treat a majority of the diseases to a great extent with a telemedicine facility. And this is a telemedicine facility which we are trying to do. We are also having mission centers. We also have what is called the mobile teleophthalmology van, which takes tertiary eye care to the rural doorstep. Again, I want to lay the emphasis on this very particular thing, the artificial intelligence. As you know, Google is doing a lot of work on diabetic retinopathy as well as the glaucoma as well. We are doing a lot of work with the Singapore National University on glaucoma as well as the diabetic retinopathy. So, can a computer perform better than a human brain? Yes, a computer can perform better than a human brain. And the computer can actually find out whether the patient is having a diabetic retinopathy, what staging of diabetic retinopathy, whether the patient is having an early glaucoma, moderate glaucoma, or advanced glaucoma. These are, and the computer can also find out, the artificial intelligence can find out, from the retinal vessel caliber, whether the patient is able to, the patient is having a cardiovascular disease or liable for any heart attacks in the future as well. So all these are going to be a very new vista. It's going to open up a new vista for us, and this artificial intelligence is going to become probably the major player, I would say the game changer in the next 10 years or 15 years to come. And this artificial intelligence, especially in this COVID scenario, because home-based equipment. For example, the patient taking a image of the retina, image of the optic nerve, and sending it by WhatsApp to the doctor. Or even the artificial intelligence to find out whether the patient is having glaucoma or diabetic retinopathy for that matter. Large-scale screening programs funded by the government or CSR funding, identifying patients in need of early treatment, especially for irreversible diseases. And chronic disease treatments such as diabetes, hypertension, hypothyroidism to be monitored and distributed kiosks, medications to be distributed decentralized points. This will prevent unnecessary burden on the tertiary healthcare facilities. And that is one of the major, for example, if you go to the All India Institute of Medical Sciences in Delhi, which is a tertiary healthcare facility, so many people are coming for this thing. And if you have people in the hospital, good hospitals, a network which takes care of the primary and the secondary problems, like for diabetes or hypertension and other things, for tertiary healthcare facilities, you can go to the major hospitals. So the burden on the major hospitals can also, the waiting time can also be reduced to a great extent. And this is what, to sum it up, the artificial intelligence, AI, machine learning, Internet of Medical Things or IoT, liquid biopsy potential to monitor tumors non-invasively, 3D printing game changer for organ and tissue repair, electronic health records or EMR or EHR, blockchain and data security, telehealth, smart hospitals, and which I told the kiosks and something like that, robotics and health tracking apps. All these are things which we were thinking about, but the COVID made us more, what do you call, as they call it, necessity is the mother of invention. There was a necessity post COVID because we were not able to get the patients to the hospital, and we were also not able to go to the do the camps to the patients. And this is the necessity which made us invent. And of course, I don't have to emphasize on this vaccine. This vaccine, Covishield and Covaxin, has actually made India so proud, all of us, in the sense that we are able to not only taking millions of people have done it here, but the millions of vaccines have been exported to other countries as well. Whereas other countries are really having a tough time in producing the vaccine, we have stood there right in the front, showing the way to the world that Covishield and Covaxin are the best, and everybody has followed this thing. And of course, what are we doing differently? I would say the government of India has done a very good job. The government of Tamil Nadu has done a very good job. As a part of the CSR initiative, we started a project called the COVID Slum Relief way back in June of 2020. And till now, we have covered more than 200 slums in this CSR initiative as part of the CSR initiative, COVID slum related, and wherein we covered slums in and around Chennai, wherein we gave the rice, the wheat, the bread, masks, sanitary napkins, the health checkup, the eye checkup, the medicines for all the slum dwellers, and each of these slums had about 250 to 300 families as well. Fight COVID-19, we can do it. Definitely, we have shown the world definitely that we can do it always. COVID-19, stay home, stay safe, stay healthy. Thank you very much for the wonderful opportunity and the patient attention as well.
Thank you, thank you. You said so many things in this short presentation, and the wealth of knowledge. We also know why people are so proud of you and your achievements and your dedication to society. That's what is there. Anyway, please wait. We will have a concluding session. Now, I would request Dr. Pattiwar, as I introduced, that he has been in government, he has been in private, he has been advisor, he has been advisor to Government of India. He holds multiple hats and multiple achievements. I would again request him to say something about himself and also about the work going on. And then later we conclude with a 5-minute talk to each. Pattiwar.
Yeah. Thank you, Shekhar sir, and thank you, Mohan sir. Thank you, Policy Times. I think this is my third time in Policy Time, and I'm interacting with Shekhar sir from so many days. And as initially I was chit chatting with him, he told me that this is the 75th episode of Policy Times. So 3 cheers for Policy Times. In COVID situation, they have carried out this educative. This is basically an educative type of webinars are there with full of knowledge and full of dedication from Shekhar sir and from the Akram sir also. I am Dr. Sanjay Pattiwar. I am basically a hardcore public health person. I have done my MD in public health. Then I have done my diploma in hospital administration from Tata Institute of Social Sciences. And then I have done my postgraduate degree in urban management from Bombay and Pune University. It was an World Bank curriculum. Because what has happened 15 years back, we know the migration has happened to the urban areas, and there was a need to have the urban planners, urban managers, and the urban infrastructure experts. And I was the only person who, from the health, got this postgraduate degree in urban management. So now I have worked in the public health in the government setup, in the state setup, and the government setup from last 35 years. Now I am working with the Tata Trust. We all know the Tata Trust is a very philanthropic organization working for the benefit of the people. And in that particular thing, I am working on the public health project of the Tata Trust. So I will give just 2-3 minutes on that because it is really important because the point taken by Tata Trust and They have an MOU with the government of Maharashtra and the Public Health Department of Maharashtra. So I will just tell you one or two within 2 to 3 minutes that we know the Mohan sir has told the digitization, telemedicine, the blockchain, the artificial intelligence. All these are the buzzwords in now the in the medical field as well as in the general field. So what we are doing, we are strengthening the ground level public health system in the rural area. You know why the India succeeded in the COVID fighting. Number one, the leadership at the central level. Second, the support by the all the political parties, all the ministers of the states. And finally the community, the people, they were very much maybe they were afraid of, or they may have reacted in responsible way. But and the finally the fourth is the primary health care system in India. These type of system are not there in the Western countries or the American countries. It may be there in some Asian countries or African countries, they are taking up now. So basically was the primary health care, and the primary health care which give the support, because we all of us know that this pandemic really it was a devastating pandemic, but the solution was very simple. The innovation was very simple. That is, stay safe, stay away, then hand washing,
Yes.
keeping social distancing. So these were the very what I can tell. Without any money, this can be done to prevent. So this pandemic, definitely, this pandemic has what I can tell you, has given a chance to health paternity, chance to health innovation, and lot of funding is going to come in the health. Otherwise, I can tell you the people who are listening to this conversation that health was a neglected subject, education was also neglected subject. But for any type of stable country or the developing country or we require a healthy population, because you know that the man hours are lost due to the malaria, due to the diarrhea, due to dysentery. All these infectious diseases were taking lot of man hours days, and taking of man hours day means the devastation of the industries. Then the economic status of that particular labor is going down. So these are all the factors due to pandemic it has come out of that. I was talking about the Tata Trust. I will tell you the digitization of the public health information system. We call it as a management information system. I think those who are listening to this conversation or those who know about the public health system in India, there are around 35 to 40 national health programs are there, and all they are going vertically. Previously they were vertically implemented, then try was there to integrate all these things, but still that factor is continued, and we want to integrate all these vertical programs, so that you know the our first point of contact is the ASHA worker at the village level. And these ASHA workers, they are really beautiful people, they are really down to earth, and they have been really given a good pre-placement training by the government of all the state governments and the central government. So basically this is the ASHA workers and health the ANMs. This is the basic structure of Indian public health scenario. And these two people and the Anganwadi worker, we call them as a triple A. That is the ASHA worker, ANM worker, and the Anganwadi worker. So these triple A's, they were doing their manual registration of the everything, manual registration of data, manually writing the names of the villages, everything was manual registers. Though it was so difficult, and it was taking around 40 to 50% of her time only in writing the registers and calculating the rates, calculating the percentage. So Tata Trust, what we are doing, we are digitizing all the family registers done by these ANM and the ASHA workers. Those people who know the public health, how the public health is working at the ground level, they can really thought of this thing. So digitization of the MIS system, digitization of the public health data at lower level is the basic aim of Tata Trust, and we are doing this in two tribal district of Maharashtra. That is, one is Palghar and second is Gadchiroli. And we have already formed a technology platform. The software has been prepared, the apps has been developed. Now we are doing the piloting study from the next month. So this is the basic thing I'm doing with the Tata Trust. Why it was important with the COVID? Because even calculating, enlisting the name of the people above 60 years of age, below 5 years of age, with the comorbidity, you people might not be knowing there is a non-communicable diseases program is there by the government of India, and in this non-communicable diseases we are now enlisting the comorbidities. Now you all of us know that the comorbidities, how important it was in the COVID scenario. So that comorbidity has been already enlisted, that has been digitized, there are portals are there, we can the portals give all type of information, but that need to be integrated, so that the digitization of the data and the integration of data, these two things are the basic public health works we are doing. Then I have done the public private participation in the government setup also. But there are two things are there for the public health public private participation. Some people say some positive things, some people say this positive things, but I think there need to be, because considering this COVID, there is a need of public private participation, at least in the pharmaceutical companies, in the vaccination, even in the digitization of the data. All these are, even the vaccinating people. I can tell you, once the vaccines are available, why not to give it to the private doctors, so it can be done very speedily. So that is very important, the private public private participation and the urban infrastructure. And I was working basically to the urban health infrastructure. All of us know that the rural health infrastructure has been defined by the government of India right back into 1950s. But the urban health was not the concept at that time, because the 95% of the Indian population was in the rural area. So the concentration was on the rural infrastructure, but the speed of migration was so high in the urban areas, so that have destabilized all the public health activities. So 30, 35, 40% of the people are now in urban area, and 60% of people are in the rural area. I can tell you that there is a really a robust primary health center in rural area, but it is not that robust in some of the urban areas, maybe 60 to 70% of the urban areas. And there are a lot of red tapeism is there. The municipal corporations, they are the local self government, and the government is different. The local self government, they have their own authorities to develop, to give the budget to that particular health sector. Because in urban areas, the state government doesn't do anything. It might be there in some, maybe in Kerala, Tamil Nadu, it might be there, but in rest of the countries, they don't interfere in the urban health infrastructure. The urban health infrastructure has to come to the municipal corporation and the local bodies. So that was the basic thing. So we have done the 5-tier system, that is the mobile IEC van, that is information, education and communication. Then the urban health center, that is the primary health center. Then the maternal health centers, the general hospital, and the tertiary healthcare center. So this was I was working in Navi Mumbai Municipal Corporation. So this was, we have done this type of 5 stages, these things. As Dr. Mohan sir was telling about this tertiary care, there is unnecessarily burden on the tertiary care. So I have suggested government of India and the government of Maharashtra that not a single the OPD should be closed down at the tertiary level. There should not be any OPD at the tertiary level. Even if some OPD is there, it is only the referral OPD. the patient who had gone to the lower level, maybe primary health center, the maternity hospital or the subdivisional hospital, rural hospital, if they are not being treated at that point, the only that patient can come to the tertiary level. So the load has will be reduced, and we can utilize the optimum or the maximum use of the tertiary care level hospitals or the human resources which are available in the tertiary care hospital. So today's, I think we will go to the today's topic. Basically, the medical care and the innovation in medical care, how it is going to help the world, how it is going to help the community. I think the COVID has opened our eyes, but the health, your health and the education, these two things are the necessity of any community or any country or any state. But the thanks to COVID, the COVID has given weightage. The COVID is giving weightage to the health budgets. We can see the health budgets have been increased in the last this just 1 month back or fortnight back. The government of India has increased the budget. Even the state governments are increasing the budget for these things. And we all of us know that the national health policy on the now has been implemented. So these two things, the basically the COVID has given the weightage to the some medical field, the health field, and the education field. So basically, I will read one paragraph. Under the normal circumstances, healthcare innovation is costly and time consuming. However, the COVID 19 pandemic has produced a silver lining of inspiring healthcare innovation around the world, with collaboration across multiple disciplines, all working towards the same goal, that is the saving of the lives. Healthcare innovation can develop at unprecedented speed when individuals focus on solving the real world problems and collaborate with the cross functional teams. Anyone can innovate from anywhere at any age, and this is open minded perspective allows innovation to occur in the finest way, motivated to final solution towards the well defined problem. So this medical innovation, Mohan sir has also given a lot of examples for the innovation, but the innovations are really important. The in the medical field, even drug we have to implement, or we have to manufacture, or we have to take the to prescribe the particular to patient. It is going to take 12 years or 10 to 12 years. But this COVID has put all the restrictions down, not compromising with the human safety and the population safety. So that is one of the basic advantage of the COVID-19 to the medical field or the innovation, because innovation always is a shiny thing. Innovation is I don't know, the innovations really, some innovations are really good, some innovations are really costly one, but we need an innovation in medical field for the poor public, for the poor population at the affordable cost. It is really important. And most of the times, what was happening, it was the market driven, it was the business driven. But this COVID has given a lesson to all the global population, that you come together, you integrate yourself, you should have your different channels come together, the engineering, the biotechnicians, the doctors, nurses, researchers, mathematicians, data scientists, data operators, all should come together and do the innovation. And I think the COVID has given this lesson to us. And the best example is of vaccine manufacturing in the world. That is the first example of a COVID pandemic innovation, which is useful for the public at large throughout the world. Because people were not knowing, because we public health people know that the vaccination is such an important thing. There is a difference between immunization and vaccination. The immunization, we have some vitamin complements or the nutritional complement, but the vaccination, why we have reduced the expectation, we have increased the expectation of life and reduced the infant mortality rate, that is due to vaccination. and a lot of manufacturing units were there in India, but the people were not knowing, because the people think that the vaccination at government hospital is of low quality, but I can assure you that vaccination at government hospital is 100% foolproof, because I have worked for 35 years and we are maintaining, monitoring everything. You name any vaccines, the temperatures are maintained. Previously it was all manual, but now it is web based, iCloud based. Everything is now in the government is also coming. So this innovation is really important due to the COVID, and the COVID has I think COVID innovation was, which is very important, that work from home, which is being this is reduced, which has reduced the many infectious diseases. So that is also one of the important thing has happened, and that is going to help the public to increase their productivity, because the communicable diseases are going to go down now. We were thinking that previously, before this pandemic, we were thinking that the communicable diseases will be replaced by the non-communicable diseases. But this pandemic has entirely changed the gamut of this thing. So now, considering the pandemics, I think the non-communicable diseases are also, or lifestyle diseases are also going to be low down. In some section, the lifestyle diseases are going to be there, but the COVID has given a lesson to the each and every person in the world, that now you should be very particular. You should have your good nutrition, you should have your good sleep, you should have a good education. So that is the innovation which has been done after COVID. So this is very important. I can tell you, the COVID has given us the, has reduced everything. I'm telling you, the suppose one innovation requires some 5 to 6 years of research activities, then the tracking activities, then the follow-up activities. But the COVID has changed all the scenario, and that is really very, very helpful for the community. I think I should not go into more into detail, but I can tell you that the innovation. One thing I can tell you, this innovation is fabricated as a shiny object in such a problem that does not exist, because the innovation has to be started from a particular level, the patient what they are thinking. It should not be the business oriented, it should not be market oriented, and the innovation should have some impact, or innovation should deliver whatever the activity or whatever the product has been developed through innovation. So that is very important. And I think there are a lot of things are there. The artificial intelligence is there, machine learning is there, language processing, virtual reality, big data, blockchain. All these are the big things are there. But still, I can tell you the mobile health apps which are there on the mobile, but still the people are not using that app. That is only they are used for the how many you have gone walking, how many steps you have taken. But there are a lot of innovations are going to come through the mobile. We know the there is Anna Vastra Pani Nivara, we tell in Marathi we do, but the mobile mobility and the transport, they are also now in this all the essential for for having the life. So mobile is going to be very essential. I can tell you this mobile will entire health apps are going to be there on the mobile, and due to this COVID, the innovations have already going occurring in that, and I think within 2 to 3 years we can find all these apps on our mobiles, and the ECG can be transported to the cardiologist. Even the sir, Mohan sir was telling about the artificial intelligence and the scanning of the retina, and the reports of the retinal injuries, retinal hemorrhage. They are going to be so accurate. I think they in medical field by the innovation of the after COVID, there are going to be the what I can tell, this pathology, radiology, all these departments are going to be governed by the artificial intelligence and the digital technology. Because in the COVID, we I think whenever there was some doubt when we were doing the antigen test, RT-PCR test, and the antibody test. So nothing was giving clue at that time. We have taken the X-rays, the CT scan, and the CT scan was finally was diagnosing the COVID patient. So that was really a better innovation which has come, and all these post-COVID innovations are going to benefit the medical fraternity. And once they are into the medical fraternity, they will in turn will be beneficial to the common man, common public, because they are going to be affordable. And this is the basic innovation, how the productivity of the general population is going to happen. So this is my particular views about the innovation and the these things. Only one thing is that India need a complex structure. India needs primary health center, then government hospitals, private nursing homes, insurance, everything India need. India doesn't India only cannot will not need the corporate hospitals, because now the insurance is coming, and insurance, we know the insurance has influenced the US health infrastructure in a bad way. Because they have not thought of primary health care. They thought that insurance is the solution for the health of the people, but insurance is not a solution for health of the people. It is a mitigation policy for the emergency purposes. The primary health has to be there, the healthy people has to be there, and healthy mindset, and all these innovation should make the people or the public as an healthy individual for the healthy country. So this is my thing. Thank you, sir.
Very, 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 very,
Fantastic.
very emotional pitch. So nicely put. And whatever you said in the end is, I hope people realize that, like you said, insurance is not the health. Insurance is just a catalyst. Of course, nobody is saying insurance is not required. But people, even when we go abroad, oh, you not got insurance, health insurance, oh, something is wrong. I do not understand how it is something is wrong when you don't have an insurance. And otherwise, if you don't have insurance, everything will be 100 times more costly. How can it be? I mean, it doesn't make any logical sense for anything. Anyway, that is a different world. Second, of course, like all of us pointed out, that Indian systems have suddenly come into a very big prominence. Many of my friends in Europe say, what my mother and grandmother said is all our rules in Europe now. Okay, you should wash your hand, you should wash your leg, you should wash your teeth, and you should. Others, people are not used to even taking bath or leave alone washing. So it has all come into the level where we were all told right in the beginning. So that appreciation, right from the word namaste, instead of handshake. Of course, it should not be instead of handshake, also should be there, in my opinion. But namaste has come into very good prominence. It has got its own, sanctity. Where does it combine with medical? By namaste, there are so many things that goes on in the body. It is not simply putting the two hands together. Same way, anything to do with, say, something like yoga and Ayurveda and all, they are intimately connected with your health system. It has got its own, way in which you can minimize. At the same time, of course, we want a robust health system with even giving more employment to people. On the side, India grows at the rate of 20 million new Indians every year. Okay. It is the responsibility of our each sector, that is from where I come in picture. Each sector gives as much employment. It should not be that tomorrow we use artificial intelligence and remove doctors, remove nurses, remove this, remove. That's what they say. That IBM, that thing will remove nurses, remove doctors. That's not correct. And that's not needed at all. Unless there's a doctor who comes and says something, a patient does not feel happy. Through mobile, through telephone, through direct touch, through direct contact, that should, I only hope technology is not taken driven to that level. It should not be taken to that level, definitely. It should never be driven to that level. That's why even with COVID, yes, in some portion of the COVID, yes, the doctors were feeling little isolated. Some part of the doctors, some part of the doctors were absolutely overburdened. The two extremes were there. One, doctors who were just not involved. I mean, they were just waiting for some patient to at least phone them because their hospitals were closed. Others were working for almost 18 hours a day, which was for about 4 months, which is one of the most fearful days of at least for Indian point of view. But now that it has opened out, we have to ensure that we come back to normal, we come back to the humanness of a doctor, we come back to the level that innovation does not mean replacement. Innovation means something giving better to the people. And I'm sure people like Dr. Rajan, would have done something so that people also can see themselves in the eyes of the others. He's an eye surgeon, and eyes of the others means in the way others look at the world progress. So, as a last 10-minute thing, I would like Dr. Rajan to give his concluding remark on how we have to be, what we have to take care, and how does he see post-COVID. Of course, for us, post-COVID is post-March. We are not talking about any COVID being removed as such. Yes, so many good things have happened for India, which we have all highlighted. So I would like to have the concluding remarks from him, then with Pattiwar.
Thank you very much, sir. And let me compliment Dr. Sanjay Pattiwar, sir, for the wonderful speech. Very difficult to speak without slides. I have never talked without slides, sir. And you did it so very well. And another thing, I think you have raised a very, very important take-home message for all of us. As I told in my presentation as well, COVID is an eye-opener for all of us. Without COVID, actually, I would say that COVID is a blessing in disguise. Because, yes, considering that our country has done well with COVID, that's one thing. But same time, on the other side, if you look at it, lot of innovations have also come. A lot of what you call lateral thinking has happened. And that is the reason why I think we are on the top of the world as far as COVID is concerned. And also the post-COVID also we are doing very well because of the innovations what we developed during the COVID period. So because we are people, we are sitting, for example, doctors like us, we are just sitting idly for about 4 to 6 months without doing anything. And this made us lateral thinking, and medical innovations all came because of that. Because if you want to do innovation, I would tell you, you need to be in a very relaxed atmosphere. Normally, when you see patients when you are on a busy day, from morning to night, you are seeing patients, you don't have time to think. And lateral thinking is not there. And lateral thinking, because of the COVID, what you call the COVID holiday, I would say, the COVID holiday made us think laterally. And because of that, lot of innovations, not only in the field of eye surgery, but also cardiac thoracic surgery, for that medicine, for that matter, radiology, so many other subspecialties of medicine, the innovations are coming, which are very, very useful to the patients. We also realize that, as Sanjay sir was also telling, that we don't have to see all the patients at all. See, the primary and secondary care will take care of majority of the patients. It's only 10% of the patients who require the tertiary healthcare system. And this tertiary healthcare has to be done only in a specialized way. Now, the COVID has taught us a lot of lessons. I think it's time for us to focus on the preventive healthcare than the curative healthcare. Till now, we have been focusing on the curative healthcare. Now we have to focus on the preventive healthcare. How to make lifestyle changes, how to have a better diet, how to have a better discipline in life, and all these are changes which will prevent diabetes, prevent hypertension, prevent even cancer by not smoking or drinking or whatever it is. So all these are preventive healthcare. We need to focus on the preventive healthcare. I think whatever rural areas we are focusing on, for example, the tribal areas, what Sanjay sir was telling about, we have to focus on the preventive healthcare because that is the grassroots level system there. Okay, the preventive healthcare starts from there, and we need to make sure that. So for that, we need to have robust public health education, sir. And this public health education is very, very important to prevent the major diseases. Once you prevent the healthcare, there is absolutely no question of any curative. Absolutely. Because the burden on the primary, secondary, tertiary, all the systems of healthcare will become less. Especially for a population of India, like India, and so many, of course, so many hospitals, so many doctors are there, it's a different issue. But the population of India, I think the preventive healthcare is where we have to focus, sir, in post-COVID. And that is what I think COVID has brought a lesson, wherein if you are not obese, if you are not having any comorbidities, you will not develop COVID. Okay, if you are going to be obese, you're going to smoke, you're going to have alcohol every day, and then you're going to have comorbidities like diabetes or hypertension, and then you can get COVID as well. Not only COVID, other diseases as well. So this is, I think, public health education and preventive health care is the area where I would focus in the next maybe decade or so, to make India a better country, so that there is universal health for all in India. Thank you very much, sir.
Thank you. Thank you.
Thank you.
Patiwarji,
Yeah,
what's
I think
your final concluding?
yeah, I have just written down the concluding remarks.
Okay.
The COVID-19 has negatively affected over 200 countries and millions of people worldwide, but it has produced a silver lining of inspiring global healthcare innovation. That is very important. Along the way, we are learning valuable lessons by data driven results. I have already told you about the data governance and for the future healthcare innovation on a global scale. That is very important. On the global scale, define problems thoroughly when possible, gather information from frontline health workers and patients, be open to all new ideas, especially the simple and inexpensive. Only keep it simple. Collaborate with other firms and wide range of disciplines. Cooperation and paramount for public health promotion is very important. Acknowledge failure as a success. This has been taught by the COVID. Acknowledge failure as success and not defeat. Innovation involves the testing and learning. Innovation is a continuous process. It is a testing hierarchy is there. So all the innovations are really due to the COVID. The funding has increased, and I think that is going to get benefited even for the small innovations which can be applied to the at the public health scale at the village level. So that is important. Increasing knowledge, shifting mindset, and changing human behavior are perhaps the most pivotal in implementing these principles. Applying these elements to innovative practices will be vital for helping other global dilemmas such as climate change, excess plastic in ocean, the freshwater supply. So now this is going to this journey is going from health education to different global problems. Now the people are going to come globally. They are going to integrate. Now the innovations are going to be simple, small, and be utilized for the public. The innovation, the profit will be thought at the end, but the effectivity will be thought at the beginning. So the profit, it may not be business oriented or market oriented, at least for few years after post COVID. So these are all the positive impacts or the positive innovation which in turn the public or the community or the citizens of the entire world are going to be benefited with this post COVID. And finally, the COVID has not gone. COVID is still there. We have to be very particular about still maybe next 6 months to 9 months. So this is my message on the innovation and the COVID. Thank you, sir. Thank you, sir.
Thank you. Thank you. Thank you. So with that, I'll give my last concluding remarks. Like you rightly said, COVID is not there. You are saying 6 months. I'm saying it is permanent. There's one more disease which has to be taken care. What are we taking in COVID? We are saying be careful. Don't unnecessarily touch, except for the mask, which looks little artificial. Other than that, everything else is what our normal life should be. I only hope quickly people will agree maskless system. And even if it's compelled, it is okay. For some reason, just an extension of a shirt, we close X amount. We also close the mouth portion, which I only pray that it goes. Other than that, COVID has, like you are rightly said, rightly or wrongly, I do not know, that it has been blessing in disguise, which is a word which I find a little difficult to say, that COVID did in my economic party, it really destroyed economy. So I find it slightly odd to say it is blessing in disguise. But it has brought, it is a compulsion, it has come, it's just like a day and night. We can't say night is not required. And along with day, night has to come. This was one of those nights which has been little bad to all of us. And we are really galloping. And we need to gallop. We need to gallop thinking of everybody. Another good point which was brought by both of you was that multi-dimensional way things will grow post-COVID. That means it will no more be one single sector being, seen individually. It now there'll be collective work. It will be work in which we will talk of all growth, and then, like you rightly said in the end, profit will anyway come. First is profit calculation, and then you start. Here you do first because that is required. Somebody is not good, means can I stitch his leg first and then think what am I going to gain, which is what going to be the future post-COVID. And with that, thanking both the extremely good talk, good, the talk itself was innovative in its own way, even though the topic itself was innovation. So, thanking Dr. Mohan and Dr. Pattiwar, I will close today's this thing, and with that, we will.
Thank you very much for the wonderful